Today our student is going to present a case study on osteoarthritis of knee. So you all know osteoarthritis of knee is a recurrent prevalence condition in our country, and mostly elderly people are getting affected because of the osteoarthritis knee. So osteoarthritis knee is the degenerative joint disease in which the patients suffer a lot to do the activities of daily living. So that it is concerned to discuss about the osteoarthritis of knee, and with the collaboration with the electrotherapy, we can use any one modality to treat the osteoarthritis of the knee properly. So let's see how the students are going to present the case and how they are going to imply any one modality in their treatment. Okay, so let's begin with the students.
Good morning. We are going to present a case study discussion with you. We are presenting a case on 62-year-old female having right knee osteoarthritis on the grade of grade 2 and grade 3 according to Kelligan and Lawrence classification. The chief complaints of the patient are chronic medial knee pain for 4 years and pain will aggregated on walking, climbing and prolonged sitting. There will be a morning stiffness that lasts for 15 to 20 minutes and is not tolerable. On the assessment, we are identified on NPRS scale pain score was 6 out of 10 and medial varus deformity is identified and medial joint line tenderness will identified and crepitus is present. Crepitus is nothing but it is the abnormal sound when we are moving the joint. The normal range is 34 during osteoarthritis. The patient contains knee range of motion on 0 to 110 degree flexion and the quadriceps strength was 4 out of 10. The functional difficulty is much more differ and vary from before and after OA, and the diagnosis as chronic knee osteoarthritis.
Okay, she said NPRS rating. So NPRS rating is nothing but a numerical pain rating scale. Numerical pain rating scale is a standard scale that rates the pain in order from 1 to 10. If the person is having more pain, they will be stating it as 10. If the person is having a moderate pain, they will be stating it as a 5 or 7. If the pain is not present or if the pain is very mild, the person will be stating in that scale as a 1 or 2 grade. So according to that grade only, we will be classifying the pain in the NPRS rating scale. So she explained about the case, the clinical features and the chief complaints of it, and how the patient was assessed and what was the interpretation during the assessment. So the next student will explain about the clinical features and the pathophysiology of the osteoarthritis of knee. You can go then. Yes, please.
Hi, I am going to tell about the pathophysiology and clinical features of OA. Osteoarthritis is a progressive degenerative joint disorder characterized by articular cartilage degeneration, subchondral bone sclerosis, osteophyte formation, mild synovial inflammation. It commonly affects weight-bearing joints like knee due to mechanical stress. Risk factors including aging, obesity, previous injury, muscle weakness. Clinical features are including pain during activity, reduced range of motion, stiffness after rest, and muscle weakness.
Yes, so the clinical features of osteoarthritis knee will not be exactly same for each person. So each person will have a different types of symptoms. Some persons will have a symptom after only a moderate to severe tear or moderate to severe degree of degeneration happened in the knee joint. Some patients will have early symptoms like initially only the one condyle of the femur or tibia getting involved will cause much difficulty for them. So we need to address them early and we need to start strengthening the muscles. As a physiotherapist, we need to know how to prevent the progression of the condition. Okay. So as I said, the patient is having the muscle weakness. So which muscle will be most prominently affected? Obviously quadriceps muscle. So we need to concentrate more on the quadriceps muscle strength training. That we will be discussing in the future. Like some other students will explain that. So we'll see what are the possible ways of using electrotherapy, and let's see what these students are going to connect the electrotherapy with the osteoarthritis. You please go. Next. Yes, what electrotherapy modality?
Shortwave diathermy.
Yes, good choice. So explain that.
Shortwave diathermy is a deep heating modality operating at frequency 27.12 MHz. It produces heat through oscillating electromagnetic fields leading to deep heating tissues. Two methods: capacitive method, heat superficial tissues morely. Inductive method, preferred for deep structures like muscles along the knee. Physiological effect, it increases local blood circulation, it increases metabolic activity, it reduces muscle spasm, improve collagen extensibility, pain reduction through gait control mechanism. Since this is a chronic condition, continuous mode SWD is preferred.
Yes. So she chose shortwave diathermy as an electrotherapy modality to treat the osteoarthritis of knee. Since the osteoarthritis of knee is the involvement of joint in the condition, so we need to deep heat the tissue to achieve a proper heating effect in the structure. So deep heating modalities in which the shortwave diathermy plays a good role in providing the deep heating. So that will give you a good heat, that will remove the pain and that will remove the inflammatory markers from the area, and it will give you a muscle elasticity. When there is osteoarthritis of knee, there will be a major stiffness that happens in the nearby muscles. So this will be a good choice. So let's see how it works. Thank you. Anyone present the elaboration about it?
I'm going to talk about the treatment parameter and safety. The patient positioning is supine lying and slight knee flexion supported by pelvis. And the parameters are mode is continuous and duration is 15 to 20 minutes and intensity mild to moderate thermal sensation and frequency is 3 sessions per week. Okay. Then contraindication are pacemaker, metal implant in treatment area, malignancy, pregnancy and sensory impairment, acute inflammation. And the precautions are the remove metal object in treatment area, check skin sensation, monitor patient feedback during the treatment.
Yes, as she said, she is using the continuous mode of the shortwave diathermy. The osteoarthritis of knee is in case severe osteoarthritis of knee need a good deep heating inside the tissue. That is why we need to use the continuous shortwave diathermy as a treatment in the parameter. So we can fix for about 20 to 30 minutes of shortwave diathermy in the treatment duration to get a better result. Okay. So we'll see what the next tool is going to present. Yes.
Hi everyone. Today I am going to explain about the integration and rehabilitation and evidence-based approach. So the shortwave diathermy is not used as a standalone treatment. Immediately after the shortwave diathermy, the therapeutic exercises are more effective and it increases the tissue extensibility. So the rehabilitation program includes quadricep strengthening, which includes isometric, isotonic and closed kinetic chain. There comes hamstring and calf stretching, thereafter patellar mobilization and proprioceptive training and functional training to sit to stand and stair climbing, etc. The evidence suggests that deep heating modalities like shortwave diathermy provide short-term pain relief and improve joint mobility when combined with structural exercise therapy. Then the conclusion says that in chronic knee osteoarthritis, the shortwave diathermy helps to reduce pain, stiffness and improves tissue extensibility and enhances the effectiveness of rehabilitation exercises, thereby improving the functional outcome. Thank you.
Yes. So as she clearly said, we need a collaborative approach. We can't only treat with the electrotherapy modality. We need to incorporate the exercise also to get a better outcome and to prevent the further damages that happens to the knee. Okay. So she included strength training, stretching protocol and what are all the home-based exercises the patient can do. She included in her treatment protocol. That is how we need to frame the protocol, not only with the electrotherapy modality but also with some kind of exercises which are must to be included in the protocol of the patient. That will enhance the recovery and boost up the functional outcomes. So what will be in our mind? We need to restore the functional outcome of the patient. The patient will be coming and consulting us because in the concern that he or she is not able to do the activities of her daily life. That is a major concern for her. So So we need to finally achieve the goal of providing an independence in activities of daily living to the patient. So that can be achieved in collaboration with the exercise therapy and also with the electrotherapy. And what are all some other occasional therapy modalities can be needed in case we can need that also. Okay. So you need to frame a protocol. Likewise, you should understand the condition, clinical features. You should understand the need of the patient. Then you can frame the protocol good. So for better understanding, you frame the protocol for any one of the case, each one, and you can discuss it in the